Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly press conference, Delaware's response to COVID-19. We have with us our Attorney General today, Kathleen Jennings. Thanks for joining us to address some issues around the election today. This is Election Day, as if you haven't figured that out. We've got just loads of people voting in every polling place that I was this morning, starting at Cape Henlopen and working my way through Sussex County and Kent County and into Newcastle County. Just people, a beautiful day out there, great day to exercise your right to vote, to celebrate our democracy here in Delaware and across the country, and a beautiful day for all of us. I was really impressed with the lines and the crowds, and more importantly, that every person in line was wearing a face mask. And I think that's really important. It's important because it's the most important thing that we can all do to help prevent the spread of COVID-19 in our community. And we're seeing some higher positivity, new cases. We'll go over that data in a minute. Most of it is in Sussex County, and we need to get the message out in Sussex County to make sure folks are being careful and private social gatherings and wearing face masks, keeping social distance, avoiding large crowds where that's not taking place, and really just taking all of this public health guidance seriously, because when you're wearing a mask, you're protecting your neighbor more than yourself, and that's a critical part of it. But we're seeing higher cases there, higher cases across our state, but greater numbers in Sussex County. Maybe for the first time, we're seeing higher cases, positive cases in Kent County, although those overall numbers are better than the rest of the state. So we need to really knuckle down. We'll see later that our cases are not as bad as in other states, which is a good thing, but not exactly where we want to be. So we'll talk about that as we move around. We also have Secretary of Health and Social Services, Molly Magarik, who's going to talk again about our efforts to protect our nursing homes and nursing home residents, which is a really critical objective of our response to COVID-19, the most vulnerable populations in our state, and where we see the most fatalities. And so let's go right to the data. We are over 25,000 total cases since our first case back in early March. Sadly, 712 total lives lost. And importantly, we keep tracking this number on hospitalizations. It continues to tick up a little bit. We were seeing some positive developments in our press conference last week, where that number was just dipped below 100. Now it's up to 107 again. More than half of those cases, going back to my earlier point, are hospitalizations in Sussex County. And we need to be mindful of the fact that our capacity in the hospitals in Sussex County is not what it is in the northern part of our state. We're still not threatening that capacity, but we just don't want to see those numbers get worse, obviously. And so they're lagging indicators, and so as we have higher number of positive cases, we're going to see more hospitalizations, and sadly, the longest lagging indicator is fatalities, and unfortunately, we'll see more of those. And so 13,000, almost 500 positive cases in Newcastle County. In Kent County, we're up to 3,600 positive cases. And in Sussex County, we are at 8,200 positive cases there in Sussex County. You know, we've been talking about the change in the way we do the calculation for percent positives. We have, since the duration, been doing that as a percentage of the positive, of the persons who are testing positive. And so if you're someone who has gotten tested more than once, you don't show up in that, your additional test doesn't show up in that calculation. And so that's going to be a higher percentage, and it's up to 9.1%, where we have been transitioning to a percentage of the tests. So all the tests that we're doing in a given day, a given week, when we get those results back, that's the denominator. The total number of tests and the total number of positive cases in that batch is the numerator. So 3.5% there, again, a little bit higher And then the number that's climbing is 165 new cases, new positive cases each day. If you think about where we were in the summer, as we were trying to stay off the quarantine list in New Jersey, Pennsylvania, New York, Connecticut, that cutoff point was about 97, and so we were above 97 one week, below it the next week. And so we've considerably moved above 97 now, so our 7-day moving average is 165, and we have some days that go over 200. A lot of that is a function of the fact that we're actually testing so many more people, and we are doing that, and we need to express our appreciation to all Delawareans who've availed themselves of the opportunity to get tested. That's a really important thing to do. Know your COVID-19 status. We'll set the record in October for the total number of tests that we'll do, and it'll exceed 100,000. Or you'll remember that our monthly goal was 80,000 tests per month. I didn't think we'd ever hit that, but we're going to be over 100,000 for the month of October, and that obviously gives us a better idea of how many new positive cases and what the level of spread is out there in the community. So we have the split by demographic, by age cohort. You can still see that young adult age group from 18 to 35 that continues to kind of unfortunately lead the way, and it says a little bit about what folks are doing in off out of work social hours, off-campus social gatherings and the like, and so we all need to be very more careful about that. So here's the 14-day view. The current hospitalizations looks a little bit flat, but we have added a couple additional cases in the latter part of that 14-day interval, but it is still pretty flat. If you look at the next chart, top middle, the new hospitals admissions each day, it tends to go up and down, and we've had a little bit of an uptick there for the last data point. New positive cases clearly on the uprise. It is with the episodic nature of our testing, it is a little bit lumpy there. It kind of goes up and down, but still on a trend upward, which is where we don't want to be. We're not as bad as other states, and we'll see that in a minute, but we'd like to see that 14-day trend going the other way, so going down from left to right. We have the two ways of calculating the percent positives on the bottom left and center. The percent of persons testing positive, which is going to be the higher percentage rate now. You saw at the beginning the 7-day moving average was about 9%, and it's been just going up gradually. It will continue to go up because we're going to continue to take people as they get tested and then go back and get tested again. We're going to be taking them out of the denominator. So if you remember your probably middle school math, you're going to realize that number is going to get, that's going to gradually grow higher as your numerator, as your denominator gets smaller. Your percent tests that are positive, again, that's a better measure of what we're seeing today because everybody's getting tested. So I've been was tested a week or so ago, and my number is not in the first graph, but it is in the second there on the day that test result came back. So that's a better indicator of the actual percent positive of the tests that are being done, and we're significantly increasing that number of tests. So if you look at the 90-day view, you can see more clearly these trends. Hospitalizations, we were down below 50 if you went back to the beginning of this 90-day snapshot, and then we're just gradually moving up. So now we're above 100, and again, now in Sussex County alone, we have over 50 hospitalizations, which is not where we want to be. New hospital admissions, again, is very episodic, up and down. It doesn't tell us a whole lot other than if we see some big spikes, then we're going to see that number of current hospitalizations likely to rise depending on how long folks stay there. New positive cases, top row to the far right. That's really the really negative thing that we're seeing, and you can see in the orange line that you have some really pretty dramatic peaks on a given day, and then maybe not as many the next day. Again, that's mostly a testing function. We are not the other challenge that we're having. We're not getting as many people to our testing sites in Sussex County, and so you're going to have much higher percent positives down there, but you're also not getting the kind of surveillance testing that you'd like. So to all of our neighbors in Sussex County, make sure you know your COVID-19 status and go out and visit one of our testing sites. Really easy to do, particularly the curative ones, the drive-up sites. Doesn't take very long at all, and you get your results back in a day or two. Again, the bottom 90-day view, the percent positive of persons on the far left and of tests, which is the one that's most important today since it includes every test that's being done in the middle. And that's pretty flat. If you go back, well, you are going back 90 days, it does increase a little bit as you move forward to where we are today. And again, some of that is a function of the fact that we're doing a lot more testing. And so that denominator is going to be a bigger number. On the next slide, our data dashboard for personal protective equipment. We got the gloves, so we're good. Gloves are a problem. On our White House call with the governors of all the other states, every other state was seeing the same kind of challenge. Our hospitals, when we were on the call with all of that, so gloves is going to be an issue as we move forward. So let's look at school reopening criteria, particularly with the new data that we're looking at, and we're in the red category for new positive cases being over 100. It's not dramatically in the red, and it's not concentrated any one area over another, although it tends to be, as I said, higher cases in the lower part of our state, particularly in Sussex County. That's where the higher hospitalizations are. Over half of the hospitalizations are in Sussex County. We're firmly in yellow in the percent test positive, so that range, yellow range, goes to as high as 8%. That's the new measure, so it's the percentage of tests that are positive, not persons. Just to be clear, going back to the data that we just looked at. And then again, with daily hospitalizations, we're still comfortably under that as well. And so since 2 are yellow, we're still in the yellow status for school reopening, meaning in a hybrid. And I know all the school districts, superintendents, teachers, staff are working hard to bring students back, and that's critically important to do that and to do it in a safe way. We'll continue to monitor the new cases, the new positive cases as it relates to the school status. But again, those other 2 criteria, the percent of tests that are positive and the average daily hospitalizations are still solidly in the yellow category. So I mentioned earlier, this slide you should be able to see it's arrows for states and showing the level of increase in the new cases per 100,000. And so you can see while we are going up, we're not nearly as bad as some of the states in the upper Midwest, which would be in the center of this slide, and some of the states in the Southwest going up towards Idaho, Montana, those states out that way, and Michigan and the Dakotas, really high increases in new positive tests per 100,000. We're not headed in the right direction. We want to be going down on that arrow, but you can see us there with the yellow bracket, kind of in the middle of the East Coast, increasing, but at a rate pretty much lower than most of the rest of the country, other than Hawaii, which looks like it's completely flat. Maybe we should all go to Hawaii, but that's a long trip. All right, so here's another way of looking at that measure of percent of new tests that are positive. In our region, the Middle Atlantic region in blue, and the Northeast is not increasing at the rate of the rest of the country. Basically, we show this not to say that our region, that we're doing good and we're comfortable with that, but we don't want to be the middle of the country in the upper Midwest and some of the states where the percent positive is in the 20% and higher. We just don't want to be there. We're going to continue to test as many people as we can get to turn out, so we're over 100,000 For October, our goal on a monthly basis was 80,000. We're exceeding that goal, getting a lot of pop-up testing sites at community organizations, churches, at various places where people gather. The Walgreens are still open for that. We get a lot of tests now at the University of Delaware and other employers who are bringing their employees back. As I close out my portion of the presentation, I just want to thank all our healthcare workers, our essential employees, our first responders that have been just on the ground working so hard over the last 8 months now, responding to COVID-19, really helping us address this pandemic in the state of Delaware and doing it, notwithstanding the risks that folks are taking, and it's our objective and responsibility to try to protect all those law enforcement officers and first responders and healthcare workers as we've done. Again, today is General Election Day. I mentioned at the top, I want to thank all the poll workers who are out there. They're in those polls all day long. Really pleased to see in the 4 polling places that I visited this morning that just everybody that was in line was wearing a face mask, and so they were thinking about others in line. They were thinking about the poll workers that were in the polls, and we just want to thank everybody for making this a safe election day here in the state of Delaware. So with that, we're going to turn it over to Secretary Molly Magarik, the Secretary of Department of Health and Social Services, is going to talk about some of our efforts to address the challenges of senior facilities and nursing homes.
Thank you, Governor. Excuse me, and I want to start just a little bit of a deeper dive into some of the areas of concern that we're watching in the state. So while we did see the numbers of positive cases per 100,000 increase in all 3 counties, the increases were actually highest in Kent County, and were high in Sussex as well, as the governor said. So specifically, the towns listed on this map are the areas of concern where, again, we're seeing higher rates of people testing positive. And that's also concerning because these towns and areas of the state also have lower numbers of people who are coming out to testing events. And so we think due to that, we probably are undercounting the number of positive cases. So as the governor said, we really urge people in these towns to take advantage of the many free and easy test sites available. If you don't want to go to the Walgreens, there's a curative site. If you don't want to go to the curative site, there's a Walgreens or a state service centers, or there's always the option of the Vault Medical at-home testing that's really easy and convenient to do. So again, I strongly urge people all across Delaware, but especially in these areas, to please go get a COVID-19 test. And so when we look to the zip code of Wilmington 19806 that appeared on the map, that zip code and the higher cases are actually driven by 2 outbreaks in long-term care facilities, which is why our recent efforts and latest efforts around supporting long-term care facilities are going to be so important. So we are very pleased to be adding a new member to our team at DHSS. Dr. Susan Levy is going to join our Division of Healthcare Quality as our long-term care medical director. She will also be supporting the State Health Operations Center in terms of providing technical assistance directly to facilities, and also being a member of the team that can help us look at all of this data, including long-term care facility outbreaks, and plan our robust response. She's a specialist in internal and geriatric medicine, and she has extensive experience not only in Delaware, but specifically in long-term care facilities. So as we head into the fall and winter, we know this was a recommendation of the Pandemic Resurgence Advisory Committee, and directly from our long-term care facility partners, asking the state to please continue to add support, technical assistance, and to be the best partner that we can be. So we're very excited to add Dr. Levy to the team. She will be starting on November 9th. And we are also looking to add, we saw this in other states, they had an incident response team. And this is a group of individuals that can go into facilities that are having an outbreak or having challenges managing their positive cases, and provide, again, another layer of support. We know that our long-term care facilities and the workers in those facilities are working very hard, but they too are struggling, and sometimes they are positive themselves, and so they have to be out of work while they're also, the facility city is managing outbreaks with residents. So we want to put together this team. We're looking for volunteers amongst DHSS employees and others within state government to be on these teams, and they will focus on infection control, COVID-19 testing, case tracking, and just general incident response. And then additionally, this is something that we have heard over and over again from long-term care facilities as well as other healthcare facilities, is that they have a number of new employees and they need to be able to quickly move them through the necessary background checks to ensure that they can begin their employment. So happy to partner with Secretary McQueen, and thank you to the governor's office as well as OMB and our partners at Department of Justice who were able to authorize CARES Act funding to pay overtime so that we can add additional hours to do the background checks and the fingerprinting. And the additional hours will be announced in the very near future. We will absolutely be sharing that with our long-term care facility and healthcare facility partners, but they will be at each of the 3 sites, the Thurman Adams State Service Center in Georgetown, as well as the Blue Hen Corporate Center in Dover, and Delaware State Police Troop 2 in Bear. And then last part of my presentation, we know, and as the governor alluded to, going into the fall, we're not necessarily in the position we wanted to be with cases rising. And so what we do, whether it's around the holidays or just in general going into the fall, is going to make a difference in our case rates and just really what happens in the state. So we've heard from a lot of individuals who have said, I want to have Thanksgiving. I want to see my family. How do I do this in the lowest risk way that I know will protect me and also protect my family members? And so I wanted to take the opportunity today to offer some suggestions, again, for how people can celebrate the Thanksgiving holiday, but still make it meaningful and engage and be part of family and community gatherings. So again, the safest thing would be to have a small dinner only with your household members. For those that typically support or are used to volunteering in senior centers or soup kitchens or other ways that they support their community, you can perhaps get together and make recipes within your household and then work on contact-free delivery to either friends, families, or other community centers. You can also host a virtual dinner. I think we've all become pretty proficient on Zoom, Facebook, and other means of electronic communication. So you can share gratitude and recipes with friends and family via Zoom. And then the time-honored tradition of watching sports and parades and other things from home, or doing a virtual 5K, again, with members of your household. We will look forward to providing other ideas, but again, really appreciate those who are asking the question about how they can celebrate the holiday while keeping not only themselves, but friends and loved ones safe. And with that, I think
Thank you, Secretary Magarik. Really important information there, especially the advice around celebrating Thanksgiving. It's really one of the best family holidays of the year, and certainly a time to celebrate and give thanks for all our blessings and the blessings of family and be close, but also a time to be careful. I mean, one of the things that probably the most important thing that we're hearing from the contact tracers, that those are the folks that interview folks that test positive and contact others that come in contact with those folks who test positive, is just the kinds of environments in which they find themselves. And they're often social events like you would have around Thanksgiving and other places in unstructured ways. It turns out places that are structured and that are controlled, we're able to control behavior a little bit better, and folks are more vigilant, I think. They let their guard down a little bit when they're just among family, which is completely understandable. But just try to be careful about that as we go through the Thanksgiving holidays. Maybe it's a good opportunity to watch whatever that sporting event. We always have, in my household, we always have little contests about what sporting event, or whether we're going to watch any sporting event on a given time during the holidays. So maybe a time to put those debates by the wayside. Really important preparations there for our outreach to the nursing homes, and we're going to get some additional staff there. Thank you to Secretary McQueen and the Department of Safety and Homeland Security for moving those background checks along. We've been hearing from the nursing home facilities they're having just difficulty getting staffing, and that's a very important part of that. So we're really delighted to have with us our Attorney General today. Lots of questions around voting and concerns that people had, so we thought we'd bring on Election Day in Attorney General Jennings to talk about those kinds of issues. I must say, Madam Attorney General, when I was out there this morning, everybody seemed very polite. I was really delighted to see so many folks wearing masks, which weren't required by the state. Highly recommended. Obviously, balancing out that democratic right to vote with public safety. And so we thank you for joining us today. It was great to see you out there this morning.
Thank you, Governor, and hello, everyone. Good afternoon. I'm here to talk with you about your vote. And I am happy, as the Governor has said, to report, but frankly not surprised, that in polling locations that we have visited throughout this state, we have seen that the lines are long, that people are eager to vote, and that everyone is wearing a mask. I want to assure you that Delawareans are safe to exercise their right to vote, that most fundamental of our rights. We know that during the time of COVID-19, people are under stress, but understand that our office, the Office of the Attorney General, the Department of Justice, along with law enforcement and every state agency with a role in today's election, have been preparing for months to ensure your safety and to ensure the safety of your vote. We are expecting the best, and we have seen the best today, but we have been prepared in the months past, preparing for the worst. Right now, our priority is ensuring that you know your rights and that those rights will be protected regardless of your party, your ideology, or where you live. If you are registered to vote, then you are entitled to vote, and your vote will be counted. The Division of Civil Rights and Public Trust of the Department of Justice, together with the Department of Elections and local law enforcement, are working tirelessly to ensure that all of your voting rights will be honored today and this evening, and with your rights to vote by mail. If you are registered to vote, you are entitled to vote. You cannot be coerced, threatened, hindered, or intimidated in any fashion. It is important that you realize that if you are in line to vote when the polls close at 8 o'clock tonight, you can still vote. So stay in that line. If you make a mistake on your ballot, you can ask for a new one. If voting machines are down, you can ask for a paper ballot. If your name is not in the poll book when you show up, you can still vote with a provisional ballot. You will be notified how to find out if your vote was then counted. If you have a disability, you can bring 2 people to help you vote. If you moved or changed your name without telling the polling place of your new address on Election Day, you can correct that by showing up on Election Day at the polling place with your new address, correcting that before you vote. If you need help in the voting booth, 2 elections officers from different parties have to help at the same time. They cannot influence your decision and must leave before you actually vote. You may not enter polls wearing campaign memorabilia, but you may enter voting rooms wearing T-shirts or slogans for nonpartisan issues. All polling places must be physically accessible. Voters with disabilities are entitled to at least 1 accessible voting machine at each polling place. Voters with disabilities can, even today, request electronic delivery of an accessible absentee ballot via elections.delaware.gov. Campaigns are allowed to contact voters in person or by phone, irrespective of no soliciting signs, but are prohibited from doing so within 50 feet of the entrance to a polling station. The Division of Civil Rights and Public Trust of our office has provided law enforcement with written guidance listing possible offenses that could be encountered on Election Day. The Department of Justice investigators in all 3 counties are right now staffing a hotline for law enforcement to contact in the event of illegal activity. There is a list of those crimes that each law enforcement agency has. I will not recount them, but suffice it to say that they cover every illegal activity that could occur. As the governor said, we have seen really peaceful lines, we have seen peaceful polling places, and have no reason to believe that that activity is taking place here. There are numbers that you may call. First, if you believe that there is a threat to your safety, that something has occurred either as you are voting or otherwise over social media or in any other fashion, please call 911 if you believe your safety is threatened. Voters who are concerned about any other problem can contact the Department of Elections voter hotline at 302-739-4277. That's 302-739-4277. Media should direct election inquiries to jic@delaware.gov. And I want to thank you for exercising your right to vote, for knowing that Delaware is prepared, has been preparing, and can assure that you are safe in voting and that your vote will count. Thank you very much, Governor.
Thank you very much, Attorney General Jennings. Really important information about Delawareans' right to vote. What we've seen out there today really warms my heart. Election Day is a really special day for all of us, not just for those of us who are candidates and elected officials, but for every Delawarean who's out there exercising the right to vote in our democracy here in Delaware. It's a big day for all of us, and if you haven't had a chance to get out to vote, you got plenty of time left to do that. If you have a vote-by-mail ballot, you need to, don't put it in the mail, take it to a drop box at your county elections office, make sure that your vote counts. Again, plenty of time to vote. We had lots of folks that had voted already by mail. It's turned out to be a very positive thing, and we'll see what happens in the future there. So I know we have some pre-submitted questions. I don't see anybody here in the audience with questions in person, but how about if we take some of the pre-submitted questions?
All right, first question is from Cody Decker at WRDE. Governor, what was your election day like? Did you vote this morning? And what are your plans for when polls close?
Yeah, it was a beautiful day. It's an exciting day. Started the day there at Cape Henlopen High School. Our Attorney General was there and other elected officials, candidates. The line was way out the door, snaked around the building, all the way back towards the athletic fields. It was really just incredible. I've never seen lines like that. Part of it, I think, was there a little bit more distance in the lines with social distancing. Everybody had a mask on, which really made me feel good. Went from there to Cheswold Firehouse, same kind of thing. The line went across the street, and from there to Middletown High School, same thing, big long line, snaking around outside. Everybody had a face mask. Everybody couldn't really tell whether they were smiling, but they were certainly seemed to be in a good mood. Obviously, Democrats, Republicans, and others, and lots of good vibes. And Thurgood Marshall Elementary, the line was incredibly long. It moved pretty quickly. Lots of district polling places, I guess, there. So just a really great day so far. Really good turnout. That's good for all of us, in my view, as many people can vote. And remember, I expected shorter lines, frankly, because we already had over 150,000 people who voted by mail. So if you think about the fact, I guess in 2016, the total votes for president was 445,000 or something like that. We had 150, almost 160,000 already had voted going into the day. 80,000 had voted by 10 o'clock. I mean, I would say it's gonna break all the records, and that's a good thing for Delaware, and it's a good thing for our country.
Next question's from Melissa Steele at Cape Gazette. Cities across the country are boarding up in anticipation of rioting tonight. Is Wilmington doing the same, and are there any measures in place to prevent rioting post-election?
Well, I'm sure our law enforcement agencies will be prepared for the worst, plan for the worst, but I hope and pray for the best. I just feel really positive about the spirit out there. As the Attorney General said, Delaware's a different place, a special place. Obviously, there are concerns from time to time, and have been, particularly during this time of COVID-19. But I feel pretty comfortable about it. Attorney General, do you have any thoughts on that?
Sure. Thank you, Governor. We absolutely do not anticipate civil unrest, as the governor says. You hope for the best, prepare for the worst. Law enforcement is prepared throughout this state, but we have no reason to believe that there will be unrest. And we really caution against anyone inciting any kind of panic, because we haven't seen any signs of it. And Delawareans have been safely and peacefully voting.
Next question is from Sarah Gamard at the News Journal. The average number of daily COVID-19 cases in Delaware has increased to 111.3, which the state considers to be an indicator of significant community spread. What will this mean for Delaware schools? Will they remain open?
Yeah, so they will. I mean, every school district right now is in a little different place. We're in the so-called hybrid mode, which means students have some remote learning and some in-person learning. Actually, most of the school districts don't have a lot of children that are doing in-person learning. They're moving mostly children with special needs and the elementary students into classrooms a couple days a week. In the lower part of our state, we do have more students that are doing in-person learning. So we still have two of the gating criteria that are yellow, so we're in that hybrid mode. We're going to keep our eye, obviously, on the situation with the new positive cases, particularly if there's any kind of geographic concentration to it. Doesn't seem to be at the moment. And those other two measures give us a comfort level that we're still in a hybrid. And by the way, that's a challenge there, just to bring students back in classrooms in a mixed kind of way, with some doing remote. Most districts, I think all districts, allow their parents to make that decision, whether they want their child to be fully remote or have some level of in-person instruction. We know that in-person instruction is the best. I hear from educators all the time how challenging and stressful remote instruction and learning is, on both sides of the Zoom call, if you will. So that's why it's so important for us to kind of really lean into the protective measures and make sure that we're following the rules and the guidance, because we want our children to get the best educational opportunity they can, which is in-person learning. So right now, districts will continue to move as they have been, to bring more children back into classrooms, get more in-person instruction, and we on the public health side will continue to focus and look at whether this is something that should change what they're currently doing. Right now, they can continue to do what they are doing.
Next question is from Lex Wilson at the News Journal. Governor, do you believe the lines we've seen today at the polls are down to high turnout, COVID-19 precautions, or some of both? As well, what are your expectations as far as voter turnout from what you've seen today?
Yeah, I'm not sure. It's like the turnout is unlike anything I've ever seen. This will be my 8th time on the ballot, and so I've been running since 2000 and volunteering for other candidates for 15 years prior to that, or 15 to 20 years prior to that, starting with my first volunteer effort was with then Senator Joe Biden in 1984. I just don't know what to make of it, other than it's a good thing when people are exercising the right to vote, whether they vote for me or not. I mean, I just think it's a really good thing. I just sensed a really positive, determined attitude, whatever political inspiration that person had. They were just determined to be there, wait in line, cast their vote, exercise their right to vote, and then we'll see what happens. And I don't really have a prediction. I won't go there.
This is the last question for today. It's from Susan Canfora at Coastal Point. Could you comment on the passing of former Delaware Elections Commissioner Elaine Manlove?
My heart was broken when I heard yesterday. Elaine was just simply a special human being. One of the most positive people that I've ever come across. She and I worked together almost 30 years ago when she first came to work for Newcastle County, when I was working with Dennis Greenhouse then. And she lit up every room. She always had a smile. She always had that Irish twinkle in her eyes, and just brought joy to everybody that she came in contact with. And then when she moved over to the Department of Elections, she was a pretty strong Democrat. Then she moved over to the Department of Elections, and she became, apolitical in that sense, but just did her job with the same kind of enthusiasm and commitment. And I know this election meant so much to her because of the new machines that she had been part of acquiring, and she was so proud when she first showed them to me a little bit over a year ago and demonstrated them down at the warehouse. And so, notwithstanding whatever happens today, I'm just going to have a heavy heart because of hearing of Elaine and Wayne's passing, and just a very sad thing. I know our Attorney General knew her as well, and I don't know if she has a thought she wanted to share.
Thank you, Governor. This is a real tragedy. It's a tragedy for everyone in Delaware. Elaine served all of the people in Delaware equally. And my memories of her is that no matter when you called her or asked her a question or needed something, she was there for you. Always kind, always helpful to others, always put you first. We are so very sad about the passing of Elaine, her husband. She had recently retired, and you never know what tomorrow brings, but she will be missed, and we love her.
It certainly is a reminder that you don't know whether you're guaranteed or the next day. I'm sure that Elaine would have loved to have seen this day happen. All the work that she put into it, and I guess the only thing that we ought to do is just follow through on our obligations to the state, kind of out of respect for her. Well, I guess we should end it there, and hope to see all of you next week.